Assalamualaikum. So today in this presentation, we will be presenting about motor neuron disease. So this is the things that we'll be presenting in our slide. First, after this, I'll introduce the team members and then we will go through the introduction on the study case and also motor neuron disease, and then we will see the cause and risk factor. After that, we'll go through the symptoms and sign, and then we'll go to diagnosis and staging. At the last, we will see the treatment option that can be given to the patient. This is our group members. First, I myself, Muhammad Arif Akmal bin Khairuddin. After that, Muhammad Akif Haikal bin Muhammad Faizul, Akila Afika binti Muhammad Darus, and lastly, we have Muhammad Arif Fitri bin Baharuddin.
So, before we jump right into our discussion on motor neuron disease, I'll brief you guys on our case study. The late Motadhari was a great football player back in his heydays. He was also known as the Super Move due to his amazing performance. But later then, he was diagnosed with amyotrophic lateral sclerosis, also known as motor neuron disease or Lou Gehrig's disease. This disease cost his life after battling it for 3 years. So from this case study, we will unravel the facts about this disease and how it got inflicted on the late Motadhari and see if this disease is actually curable or at least treatable. So now I'll introduce you to motor neuron disease itself. Motor neuron disease, or in short is MND, is a relatively rare neurodegenerative disorder of the motor system in adults, characterized by the loss of motor neurons in the cortex, brainstem, and spinal cord, manifested by the upper and lower motor neurons, signs and symptoms affecting bulbar, limb, and respiratory muscles. Death usually occurs 3 to 5 years after onset from respiratory failure, but some may survive for a decade or more. And unfortunately, there is no currently cure for MND. Treatment primarily concentrates on symptom management and enhancing the individual's quality of life.
So, now we will go through cause and risk factors. First, we have neuronal dysfunctions. The exact cause of MND remains unknown, but it is believed that dysfunction in motor neurons, which control muscle movement, plays a significant role. Then we have environmental triggers. Exposure to toxins, heavy metals, and certain viral infection may act as triggers, increasing the risk of developing MND. After that, we have genetic factors. Although most cases are sporadic, certain genetic mutations, such as in C9 of 72 genes, have been found to contribute to the development of MND. Last, we have exposure to viruses. Retroviruses of mice can cause MND and lymphomas, and because there is an increased incidence of lymphomas in ALS patients, it has been suggested that retroviruses are another possible viral agent of human MND.
Okay, for symptoms and sign of MND, the first symptom is respiratory problems. In later stages, MND may lead to respiratory muscle weakness, requiring assistance for breathing and increasing the risk of respiratory problems. This problem also included reduced lung function, shortness of breath, increased susceptibility to respiratory infection. In the end, MND patient may require ventilatory support to assist with breathing. The next symptom is loss of motor control. As the disease progresses, individuals may experience difficulties in speaking, swallowing, and performing everyday tasks. There are some key aspects of motor control loss in motor neuron disease, such as genetic factors, neuroinflammation, and oxidative stress. And lastly, the next symptom MND patient will experience is muscle weakness. Gradual muscle weakness, often starting in the limbs, is a common early symptom of MND. Next, we will take a look at some diagnosis and staging for MND. First of all, we have electrodiagnostic tests. Electromyography (EMG) and nerve conduction studies (NCS) help determine the extent of motor neuron dysfunction. This is because EMG measures the electrical activity of muscles and is used to assess the health and functioning of motor neuron and muscles, while NCS assess the speed and strength of signals traveling along peripheral nerves, helping to identify abnormalities in nerve function. For staging and prognosis, MND progression is categorized into stages, aiding in treatment, planning, and providing insight into an individual prognosis. There are some factors that may affect an individual prognosis, such as age at onset, respiratory involvement, cognitive function, and genetic factors. And thirdly, there are clinical assessment where doctors evaluate symptoms, perform neurological examinations, and review medical history to make an initial diagnosis.
Hi guys, for treatment option we have three options. First is medication, second is physiotherapy, and the third one is assistive device. For medication, various medications such as riluzole and edaravone can help slow disease progression and manage symptoms. For the second one, physiotherapy. Physical therapy programs can improve muscle strength and flexibility and manage mobility challenge associated with MND. The third one is assistive device. Innovative technologies including communication aids and mobility device can enhance independence and quality of life. In conclusion, motor neuron disease (MND) is an incurable disease for which a highly effective treatment is still pending. Symptomatic treatment remains the mainstay of management. A multidisciplinary approach embracing advanced in non-invasive ventilation and gastronomy can improve quality of life and extend the survival of MND patients. That's all from us. Thank you. Bye-bye.